Well, I'm P Yadava. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. Well, in experienced times, it is now said that redo surgery is no more an incremental risk factor. But having said that, I do grant that redo surgery is technically demanding because of the additions. There are complication rates associated with re-entry when you do a sternotomy, and if the heart is stuck to the sternum, sometimes injury to the chambers of the heart take place. Injury to a patent graft could be a senior complication, and whenever we dissect the heart, then some of these atherosclerosed and thrombosed grafts may embolize distally, and the perioperative myocardial infarction rates do tend to go up. But if the operation is performed in experienced hands, then nowadays redo surgery, especially if the ventricular function is satisfactory, can be performed with a mortality under 2%.